Good morning, my dear students. Welcome to Rishikul Online School. Today we are going to start a new chapter, chapter 2 of Civics, that is role of the government in health. Dear students, this is the first module of this chapter, and in this module we shall study about health and healthcare services in India. So let's begin with the discussion on role of government. In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads, electricity, etc. So, in this chapter, we shall examine the meanings and problems related to health. Now, the question arises, what is health? Dear students, we can think of health in many ways. Health means our ability to remain free of illness and injuries. But health is not only about disease. You may have associated only some of the situations in the above collage with health. What we often ignore is the fact that each of the above situations is related to health. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness. Healthcare in India. Dear students, the state government is responsible for planning, implementing, and monitoring schemes to improve public health. It sets up health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. In order to run such healthcare facilities, health workers, nurses, doctors, and other health professionals are also employed. These people advise, diagnose, and treat illnesses. We also need medicines and medical equipments for treating patients. Our state governments arrange them. The government expenditure on health is jointly shared by the central and the state governments. Positive aspects of healthcare in India. Dear students, India has a good number of doctors, clinics, and hospitals. It is among the largest producers of doctors. Healthcare facilities have grown substantially over the years. The number of hospitals grew from 11,174 in 1991 to 18,218 in 2000. India gets a large number of medical tourists from several countries. They come for treatment in some of the world famous hospitals in India. Dear students, India is the fourth largest producer of medicines in the world and also a large exporter of medicines. Negative aspects of healthcare in India. Dear students, rural people face the crisis of doctors because most doctors settle in urban areas. They have to travel long distances to reach a doctor. About 5 lakh people die from tuberculosis every year. Clean drinking water is not available to all. As a result, poor people easily become prey to various waterborne diseases such as diarrhea, worms, hepatitis, etc. Half of all children in India do not get adequate food to eat and are undernourished. So, my dear students, that was all about this module. We shall continue this chapter in next module. Thank you.